Presbylaryngis is age-related voice changes that commonly occur after age 50. It is also called as aging larynx. It leads to voice fatigue, weakness, and altered pitch. In men, mean fundamental frequency rises after 50 years of age, and voice would be thin, reedy, and high pitched, while in female, mean fundamental frequency decreases with the age, and voice having lowered frequency or lowered pitch. Pathophysiological changes are ossification of laryngeal skeletal, arthritic changes in cricothyroid or cricoarytenoid joints. There are muscle changes like loss of type 1 slow contracting fibers, muscle atrophy, and there is increased collagen density in the lamina propria while decreased hyaluronic acid in the lamina propria, and there is reduced fibroblast that may lead to atrophy of the vocal fold. In aging larynx, there is stiffened broad atrophic vocal fold. You can see this left vocal cord compared to normal right vocal cord. So changes are just like the left vocal fold. There is poor glottic closure, breathy or weak voice, reduced vocal endurance is there. Clinically, weak, breathy, high pitched voice in the male, while low pitched voice in the female. Vocal fatigue, reduced loudness, tremor, instability. Patient often worry about cancer. There is bowed left vocal cord, a spindle-shaped glottic gap, atrophic appearance vocal fold, and reduced mucosal wave on stroboscopy on the this left picture. Left picture showing the aging vocal fold and right showing the normal vocal fold. Management include voice therapy, vocal hygiene, injection medialization, and thyroplasty type 1. In voice therapy, you can strengthen the laryngeal muscle, improve vocal control, avoid irritant like smoking, dehydration. Injection medialization by hydroxyapatite and fat will be less time duration and hydroxyapatite for the prolonged duration. Thyroplasty type 1 means medialization of vocal fold can be done. Prognosis wise, voice may improve with therapy, surgical option for severe cases, and results are variable depending on the degree of the atrophy. Now, some MCQ on this topic. First MCQ is in male, how does the mean fundamental frequency typically change after the age of 50? Options are A. Decrease significantly, B. Rises, making voice high pitched, thin, and reedy. C is remain unchanged, and D is fluctuate unpredictably. Answer of this question is B. Second MCQ. In women, what happens to mean fundamental frequency with aging? Options are A. Increases, B. Decreases, C. Remains constant, D. First increases, then decreases. Answer is B. It decreases. In males, the mean fundamental frequency tends to rise after the age of 50, while in women, the mean fundamental frequency tends to decrease with the age. Question third is which histological change is associated with presbylaryngis? Options are A. Increased hyaluronic acid in lamina propria, B. Increased fibroblast in epithelial layer, C. Decreased hyaluronic acid and reduction in fibroblast, and D. Is hypertrophy of muscle fiber. Answer is C. Decreased hyaluronic acid and reduction in fibroblast. MCQ 4. What is net effect on vocal folds in presbylaryngis? Options are A. Hypertrophy and thickened fold. Option B is stiffened, bowed, and atrophic looking fold. C is overly vascular and edematous fold. And D is normal folds with only mild changes. Answer of this question is stiffened, bowed, and atrophic looking fold. Fifth question is which of the following is not commonly used injection material in presbylaryngis? Options are A. Fat, B is hydroxyapatite, C is collagen, D is botulinum toxin. So, injection material not used in Presbylaryngis is the botulinum toxin.